What exactly is in-home care, and when should we consider it? Home care providers can provide care for seniors who need a little bit or even a lot of help in order to remain in the home they love. It is important to note that home care is very different from home health, which is often covered by Medicare insurance. Home health is prescribed by the hospital or primary care doctor after a hospital stay or surgery and can assist with nurse visits, occupational therapy, physical therapy, wound care, and pain management. Home care agencies can help with anything non-medical in nature, including personal care, such as showering, dressing, toileting, or transferring from a bed to a wheelchair. They also help with light housekeeping, driving for appointments or pleasure, as well as meal preparation, medication reminders, overnight care, dementia care, palliative, and hospice care. Some in-home care providers can provide medication administration under a program called nurse delegation. Make sure to ask the agency if this is something they can provide. Regardless of the level of service, Washington State requires all employees of home care agencies to be certified as nursing assistants, CNAs, or home care aides, HCAs. When to choose in-home care. Choosing senior home care can seem overwhelming as you narrow down the best options for you or your family member. Your decision process should include your specific needs, family circumstances, aging-related concerns, budget, time, and other factors. An in-home personal caregiver might be your best choice if you're looking for quality senior care that promotes aging in place and is cost-effective. If around-the-clock care is necessary, a skilled nursing facility or memory care facility may be the more affordable option, but only in the home will you receive one-on-one care directed by the family. Here are some common scenarios where it makes sense to consider in-home personal care. Your decision is to remain at home for as long as possible, but assistance is needed to reach that goal. If care needs are changing due to aging or ill health or subtle behavioral changes are beginning to surface, it may be time to consider in-home care. Whether you are looking for help with meal preparation, housekeeping, laundry, or companionship during the day, an in-home personal caregiver can provide the assistance you need. Senior home care promotes independence, allowing you or your loved one to continue performing the daily tasks he or she can do for as long as possible. Health or mobility challenges pose a risk that might require moving out of the current home. Some health conditions require 24/7 care in a skilled nursing facility, but many mobility and health concerns can be safely and effectively managed at home, while providing peace of mind for everyone involved. In-home personal caregivers can provide personal care in bed, help with transfer assistance using a gait belt, Hoyer lift, or sit-to-stand. They can provide medication reminders, transportation assistance to medical appointments, fall prevention, safety assessments, and other services to manage medical needs. Some service providers also offer additional virtual options to provide 24/7 access to emergency responders. Your loved one has dementia and you want them to remain in a familiar place. If your loved one is living with dementia or Alzheimer's disease, familiar faces and surroundings, as well as daily routines, may be essential to their well-being. A move to a new residence means changes such as altered schedules, new caregivers, and a change in surroundings. These changes can be scary and disruptive for someone already struggling with dementia. In-home personal care helps your loved one stay safe and receive the customized dementia care he or she needs from a trusted caregiver. Family caregivers need a break. Respite care provides family caregivers with emotional and physical relief they need so they can practice proper self-care, concentrate on work or family, manage responsibilities, and avoid caregiver burnout. Respite care can be scheduled for a few hours or weeks so a family caregiver can go to an appointment, take a vacation, manage other family needs, or run errands. Couples with different levels of care but want to remain together. When older spouses have different care needs, a senior care facility could end up separating the couple. One spouse, for example, may need to move into the assisted living wing of the facility, and the other spouse moves into the memory care section. Separation creates its own set of issues. In-home care can provide an alternative option that allows spouses with more care needs to receive personalized assistance without having to undergo a stressful move or separation. A personal caregiver can provide an added layer of support for the spouse who requires the lower level of care. This enables more quality time spent with his or her loved one. One of your aging parents can no longer meet the care needs of his or her partner. When an older adult has spent a lifetime with his or her spouse, it's only natural to want to care for their ailing partner at home. However, even though one spouse may be healthy, he or she is still aging and may not be able to cope with his or her partner's care needs, as either the ailing partner begins to need more care or the caregiving partner has his or her own health issues. In severe cases, this can lead to an unsafe environment for the care recipient as well as the caregiver, and may cause an overall decline in the caregiver spouse's health. A professional caregiver can keep both older adults in your life safe and healthy in their home. Why you should hire an in-home care provider rather than a privately hired caregiver. Agencies provide ongoing supervision. Care coordinators contact you by phone and personal visits to ensure your caregiver consistently provides kind, considerate, and appropriate services and care. Backup plans. In case your designated caregiver has an emergency or is ill, an in-home care agency will work to ensure continued coverage. Payroll taxes and workers' compensation coverage. In-home care providers handle payroll tax deductions and other insurances. This relieves you of the risk of an income tax penalty, unemployment, or workers' compensation claim should you need to terminate the caregiver or they become injured while working in your home. Employment and pay issues covered. An in-home care agency eliminates the uncomfortable employee-employer relationship if issues come up regarding pay, time worked, or quality of work. Careful screening and hiring process. In-home care agencies complete an extensive background and reference check, including an FBI fingerprint background check and skills assessment on all caregivers to ensure only the most qualified and trustworthy caregivers will be in your home. Marilyn Oswald, Visiting Angels, owner, director, serving Kitsap County and surrounding areas. 360-602-0609. Visiting Angels offers Constant Companion, which combines voice-activated medical alert technology with the Amazon Echo's Dot device to provide 24/7 access to emergency responders. And best of all, Constant Companion works without a wearable device.